So
While
can we
there are
start?
no, wait, there are no viewers. Let some
Okay.
viewers come, then you can start.
Okay, fine. Guys are still joining.
I'll just put a message on Rotaract groups also to join.
Okay, fine.
While we can start with the protocols. Hello, Payal.
Okay, Komal, ठीक है. Shall we start? Hello, Komal.
Hello. Yeah, you can start.
Okay. So, a very good evening, one and all. Myself, Rotractor Payal Sen, President of Rotrac Club of Lakshmi College of Optometry. So, Zone 1, take privilege to welcome you all for our today's webinar on the topic of eye donation awareness.
Thank you, Dr. Payal, for your introduction. Now, I kindly request you to proceed with the coloring.
This meeting is called to order.
I request everyone to kindly stand up for the national anthem, followed by the four-way test. Now, I request everyone to please repeat after me. Of all the things we think, say, or do,
Of all the things we think, say, or do,
is it the truth?
is it the truth?
Is it fair to all concerned?
Is it fair to all concerned?
Will it build goodwill and better friendship?
Will it build goodwill and better friendship?
Will it be beneficial to all concerned?
Will it be beneficial to all concerned?
Thank you. Over to you, Rotraka Payal.
Thank you, Pooja. So, namaste, a very good evening, one and all. I extend my heartiest and warm welcome to all the viewer, all the Rotarian, all the district council member, faculties, collaborator club, and my fellow Rotractors on our first PD international event. The topic for today's webinar is eye donation awareness. So, what exactly brought us here today? Why we have arranged this session? So basically, there are some myths, some questions, some doubts about eye and organ donation. So we come across now and then, and lot of people are partially aware of these things. So to clear up all the doubt, all the question, myth, and queries, and to get to know more about this topic and to know how we can help someone by giving a small tissue of your eye so that it may give sight to someone who may praise you for whole life, we have arranged this session. So the main aim and the main motto behind the event is be a symbol of hope for those who are waiting and try to fill color in their lives. Now, I would like to introduce our today's amazing speaker, Dr. Niket Gandhi, serving as cornea specialist and cataract services at Lakshmi Eye Institute, Panvel. He has completed his post graduation from Lakshmi Eye Institute and his Lakshmi Eye Institute and pursued his fellowship from prestigious LV Prasad Eye Institute, Hyderabad. For eye donation, he specializes in ocular surface, corneal pathologies, and uveitis. Now, I request Dr. Niket Gandhi to please enlighten us and provide us wholesome knowledge about the eye donation and organ donation. Over to you, sir.
Good evening, everyone, and I am absolutely thrilled to be giving this talk at this juncture, and I thank Rotractor Payal Sen and the Rotrac Club for inviting me for this talk. I have a deep association with the Rotary Club of Panvel as well because my father was a past president of Rotary Club of Panvel, and we, as young and Anits, used to spend a lot of time in Rotary. So it is indeed a pleasure to really come here and speak for this topic, which is very close to my heart. I'll just share my presentation now. So again, this topic is very important at this juncture and at this phase of our lives, as the time around us is constantly changing and the world around us is constantly changing. As we all know that the organ donation day is celebrated on 13th August, and eye donation fortnight is celebrated from 28th August to 8th September. As a ophthalmologist myself, I am especially inclined to urge all of you to take an active part in these activities and let us just participate wholesomely to increase these particular endeavors. Now, Helen Keller, the famous activist, said that there is no lovelier way to thank God for your sight than by giving a helping hand to those in the dark, and it is indeed extremely true. So, just to get to the right down to the basics, I would like to inform you as to what exactly is eye donation, when do we do it, why do we do it, and who all can do it. So coming on to the what part of the question, as we probably know, but let me clarify that cornea is the transparent part of the eye which helps us to see. It is an extremely important part, and this is particularly helpful in keeping our vision clear. Now, if we imagine that the eye is like a camera, then the cornea and the lens apparatus would be something like the lens of the camera. And any and every light which passes through this particular apparatus will help us to see clearly. Now, it is extremely important to keep the cornea healthy, to keep it to maintain its clarity and health, so that it can flawlessly bend light and give us a clear, crisp, and sharp image. But what happens when the lens is not clear? It's scratched. The vision would be blurry, and we would expect that the vision should be sharp. The picture should be sharp, and that is only possible if we have a clear lens. So, what exactly happens in cornea in corneal diseases? Things like corneal ulcers, keratoconus, corneal scar, corneal degenerations, edema, and corneal dystrophies are some of the few pathologies which can happen in the cornea, and this can impede the kind of vision the patient has. As you can imagine from these pictures, the picture is not absolutely clear, as and you will know that light just cannot pass through this unclear lens, and the vision would be extremely blurry for these patients. So, what do we do as corneal surgeons in these cases? We replace the cornea. We replace the diseased cornea with a healthy donor cornea, and what we need to understand here that it is one of the most successful solid organ transplants which is there. In terms of the organs which can be transplanted, we have kidneys, we have lungs, we have skin, we have other organs which are extremely useful, but they always have a chance of rejection, and so does the cornea. But among them, cornea has a very high success rate. Again, the types of corneal transplant is something which we need to understand, and I'll explain you why. Now, as you can see from the earlier pictures, that to maintain a clear visual quality, we need to remove the diseased part of the cornea. However, with the help of the corneal which we receive, we can actually help two patients, and it is also better for the patient in some of the aspects. As you can see on the figure on your right, that in most of the cases we perform a full thickness transplant, but in other cases we don't need to transplant the full cornea, but we can transplant only part of the cornea, whether it is the upper layer or the diseased lower layer, and we can actually use these cornea technically for two patients. So as this picture suggests, that in case when the cornea is not clear and it is diseased, what we can do is excise this part of the cornea, remove it. With the help of the donor, we can actually transplant a clear cornea, and we can help restore the vision in these patients. As I explained earlier, there are different type of keratoplasties. Keratoplasties is a procedure where we replace the diseased cornea, and that can be either optical keratoplasty, therapeutic keratoplasty, anterior lamellar, or posterior lamellar keratoplasties. Now, once we know that what exactly is corneal eye donation, or what exactly is we do when we ask you to donate the eyes, it is to understand as to how can we do it. So, as everything in our life, it has a few steps which are important to adhere to. The first one is the donor selection. Second is tissue retrieval, then corneal examination, storage, and distribution. So these are the few facts which we need to know while we are donating eyes. Once our loved dearest are deceased, it is important to know that we need to encourage them to actually and motivate them to donate the eyes. Once that is done, we call the nearest eye bank. We switch off the fans in the room, keep the ACs on, place wet cotton on the closed eyes of the donor, and raise the head with a pillow. And we also should keep our death certificate ready. Now, religious views on organ donations have evolved over a period of time, and be it Hinduism, Islam, Sikhism, or Christianity, everyone actually encourages their devotees to donate organs so that we are able to help the needy. There are few facts when we are actually retrieving the cornea. So eyes need to be donated within the 6 to 8 hours of death. So this is an important landmark because if due to certain reasons this time is not adhered to, we will not be able to use these corneas. Unlike belief, there is a belief that it is going to take elongated time, and the funeral proceedings may be disturbed. But that is not true. The total removal time is only 15 to 20 minutes. We do require 10 cc of blood sample and RT-PCR nasal swabs for COVID-19, and we do not remove the whole globe. We just remove the corneoscleral rim, which is useful for us later. Again, people who have spectacles or have done previous surgeries are also eligible to donate their eyes, and other systemic diseases like hypertension and diabetes can also be donors for this noble cause. Now, obviously, like anything, there are certain people who actually cannot donate their eyes. These include patients who are affected with rabies, syphilis, hepatitis B or C infection, AIDS, septicemia, periocular malignancies, encephalitis, unknown pneumonia, and COVID-19. Next, once we do receive the corneas from these donors, we examine them. As a cornea specialist, we are trained to do so. And what we do is we do a gross examination of this cornea. We check the storage media, whether it is healthy or it has any contaminant. We do an in-depth assessment of the cornea which we have received, its transparency, its biomicroscopy, and we also measure the quality as to whether they are eligible for distribution or not. So it is important to understand that with the help of sophisticated technology and equipments, we are able to even see cells which are very crucial to this procedure, and we can help the patients in the best possible way. And it is important to understand why this is possible or why it has to be done. Not each and every cornea is suitable for transplantation. We need to be extremely careful because it is our responsibility towards the patient that they receive the best possible treatment. And to do that, we need to be very careful about the kind of corneas which are transplanted in the patients. Now, this is a very important juncture where we can just discuss a few myths and facts about eye donation. Now, this is something which you will hear very commonly, that donating eyes will disfigure the face of the donor, with holes in the eye socket causing face disfigurement. Now, that is absolutely a myth. The corneal retrieval process is an extremely clean procedure. There is no there is no dripping of blood anywhere. There is no any socket hole formation in the socket of the face, and the before and after picture of these donors is absolutely unrecognizable. Next thing you will hear them say is that donating eyes when I die in this life will mean I will be blind by birth in my next life. Again, absolutely untrue. Although our society is we have a lot of superstitions and a lot of belief, but in our core, as human beings, we do understand that helping others is what is helping us survive in these difficult times. Organ donation is and organ donation and eye donation is to be looked at as if that your legacy is living on, and others who are in need are they will be it will be beneficial for these people as well. Now, there is another belief that my family will not like it if I decide to donate my eyes. Again, it is an absolutely a myth. Sometimes when the family members hear that they have actually uh, volunteered to be organ donors, they are absolutely they are very supportive in this cause, because they understand that it is post the disease where he will not be able to help anyone, but the kind of organ donation which he does is going to help maybe n number of lives. Probably 6 or 7 lives can be improved with the help of organ donation. Again, eyes of Indian donors are not suitable for corneal transplant. Again, it is an absolutely a myth. God has created eyes equally for all human beings, and in the end, the onus is on the ophthalmologist or the corneal specialist to determine which is the best kind of eyes which are suitable to the patient. It is ultimately our responsibility that the patients receives the best care, and irrespective of caste, creed, gender. It is extremely gratifying to know that slowly but steadily people are opening up their eyes and are open to organ donation. Again, corneal transplantation is an experimental procedure with a poor success rate. Obviously, it is an absolute myth. As explained earlier, among the other solid organ transplants, the cornea donation is extremely successful and has a highest percentage among them. Again, my donated eyes can be sold. Here I would like to just be very very cognizant of the fact that no such thing is done. Unfortunately, Hollywood has really portrayed this particular situation in a Bollywood, this particular situation in a very bad light with a recent movie like Andhadhun, where they take a live donor for eye donation. So that is absolutely untrue. First of all, the Human Organ Transplant Act is extremely stringent in these cases. And second of all, you cannot make an organ eye donation from a living member. The person has to be deceased, and only then we are allowed to actually take the eyes, and that is also after the consent of the kin. So if I have pledged my eyes for donation, no further consents are necessary after my death. Again, that is untrue. After a person has died, his next of kin are authorized to give us consent to do a cornea retrieval. And that is why even not just you as a person, your family members, your friends, everybody needs to be aware of the fact that this particular activity can be done after death. Once the person dies, it is impossible to really know. And if you inform others and increase the awareness for this, then and only then we'll be able to retrieve the cornea, because without the consents of the kin, we'll not be able to even touch the person to retrieve this cornea, even if you have pledged your eyes. And again, if elders who have not really pledged their eyes, they can also pledge their eyes irrespective of them being actual people who were earlier interested in this. The kin can actually take a call and allow us to retrieve the cornea so that their legacy lives on. And this is where the eye bank like Lakshmi Eye Bank comes into picture to increase this particular knowledge. So again, an eye bank is an organization which deals with collection, storage and distribution of cornea for corneal transplant and research purposes. And this is where Lakshmi Eye Bank has been working over the past 25-30 years to increase the awareness and increase the work which we have done, which is initiated by Dr. Suhas Aldipurkar so many years ago. and its function is first and foremost to promote eye donation by increasing its awareness, registration of people, collection of donor eyes from the disease is our responsibility. Receiving and processing of those corneas, preservation of the corneas, distribution of the corneas, and training and research activity is something which we take a lot of interest in. Again, it is important to understand that this cannot be done alone, and it needs help from all of you as well. But as you all are aware that I have explained in detail why do we need to promote eye donation activities. Now coming on to the brass tacks and the ground reality is that the total blindness in our country is 48 lakhs, and among which out of which 11 lakh people are awaiting corneal transplants, and newer cases are being added every day. It affects many children, young adults who have a long life ahead of them. We do have trained surgeons and equipped hospitals, but lack of donors. Without the donors, we cannot do anything in such cases. A recent survey which was taken from 2015 to 2019 among a huge excuse me, among among these districts tell us an important picture. it tell, it tells us that although cataract is the most common cause of blindness, corneal opacity and cataract surgical related complications form a huge percentage among these people. So why should we donate eyes? Because it is a gift of sight. It is a noble gift. You get to help someone after death. Your legacy lives on, and it reduces the social and economic burden of families and nation. What As young adults, what can we do? We can learn about eye donation. We can pledge our eyes, encourage people around us, make eye donation a family tradition, so that others and our elders are also informed about this. And we can volunteer to counsel families of the deceased and motivate them for donation. Then we come to an important aspect which has changed your life in the last 1.5 year. That is coronavirus. Coronavirus has devastated our way of living. It has changed how we live, how we think, and like everything in our lives, including our personal lives, professional lives, this has affected this particular activity as well. Recent And this is not something which is the government is unaware. As you can see in Mumbai, in Nagpur, and all over the country and all over the world, the transplant list keeps on increasing because the eye donations have absolutely dried up. There has been minimal eye donation from all sectors of society, especially in Maharashtra as compared to the other states. A recent survey in 2019 by the All India Institute of Medical Sciences tells us a grim picture where last year they had a collection of almost, in 2019, they had a collection of almost 7,000 corneas. In 2020, that number reduced to only 1,200. And the transplantation, which were done in 2019 of 2,300, have reduced to 515. Closer to home, this statistics tells us of Mumbai, where in 2018, a hospital between April and July had registered 194 patients, and in 2019, 206 patients, but in 2020, only 20 patients were registered, and in the same time, zero surgeries were conducted last year during those 3 months. So again, this is where NGOs like the Rotaract Club, the Rotary Club, and others will help us to spread this message all across. And how would they do that? So again, public education is extremely important. Public sensitization through spiritual religious leaders for propaganda of advocacy and communication regarding eye donation is important. We need to encourage and engage with these NGOs so that we can, get across the message across the communities and not just within the medical community. Collaborative approach between public and private partners and involvement of NGOs for advocacy, communication, and social mobilization is extremely important. Publicity campaigns, they just strengthen the awareness. Recipient family can share their experiences. We need to integrate grief counselors, ASHA workers, nurses, and volunteers, and the NGOs as well. Again, there can be multiple novel ways where this can be done. This can be done by, we can conduct a spelling bee, a quiz contest, science fairs, essay writing, painting, slogan captions. Offices and multinational companies can help us to incorporate the awareness in their culture, including and of course clubs like Rotary Club, they can also help us to further this endeavor. Again, eye donation awareness programs and need for development of these programs is extremely important. The last, I want to actually, the execution post the awareness and post the message which we give across all these activities. It is important that we actually recover and these corneas. So, home deaths, death place, cremation grounds, through priest and religious leaders, road traffic accidents, suicides, and deaths through emergency medical personnel and police officers, and family physician and general practitioners can all help us to increase the eye donation. Again, at primary health level, we can involve village and health volunteers of the concerned village, involve ASHA workers, and eye donation at vision center level, and referral to these vision center levels can help to further these causes. In the end, it is our responsibility to clarify the general misconceptions, to motivate the behavioral change, make donation community expectation and a family tradition, provide long-term support to family donor families, and recipient family as motivators, patients as channels of change. Because with these responsibilities only, we'll be able to overcome the gap which is there, and just try and attempt to overcome this difficult time and build the bridge between the deficiencies which are there to eliminate corneal blindness from our country. And a sincere request is, we do not need to burn these eyes, we do not need to bury these eyes, we can actually donate these eyes so that others may see. Thank you very much, and please do contact us for any further inquiries on this particular number.
Okay, so with this wonderful session, we have a lot questions here. So we'll start with it. Yeah, so which age group of people are eligible for donation?
That is an extremely relevant question. So I need to again emphasize, people from all age group are actually eligible for donations. How it works is, the younger the person, the better cornea he is expected to have. But just because the person is old, like even we have done corneal retrieval from people who are 95, 98, even 100 years old. Those type of corneas are also useful to us, and they can be used in emergency circumstances as well.
So next question is, can a person who has undergone cataract operation still donate eyes?
Absolutely. So, as I informed in my topic as well, irrespective if they have spectacle lenses, cataract surgeries, or any other type of surgeries, all of them can donate eyes. So, these kinds of eyes are also important. In the end, it is our assessment of as corneal surgeons which will determine whether they can be used in a patient or not, but they can always be used for research purposes.
Okay. So can person wearing spectacles donate eyes?
Yes, yes.
Then Can eyes be donated if the one who pledges his or her eyes is blind? Can eyes be donated if the one who pledges his or her eyes is blind?
Yes, as we know, all know that blindness may have different causes, and if there is an absolute willingness from the kin of the deceased, then we can definitely go ahead with this. And we also would love to respect the wishes of the deceased, as well as spread the message that this can be done by anyone. So
Okay.
yes.
So there are like in anything or in any like anything we have exceptions, and like there are a lot of exceptions. So who can't donate eyes?
So, as I mentioned in my presentation as well, patients with any infectious diseases like rabies, syphilis, HBV, HCV, cancers, and COVID 19 are a few of those who cannot actually donate their eyes. So, it is not something which we can use in our patients as well.
Okay. So would someone with macular degenerations uh, donate? Would someone with macular degeneration benefit from corneal transplant?
As again I said in my presentation, the cornea is only the front part of the eye. It is like the lens of the eye. Unfortunately, macular degeneration deals with retina, where the as you can see, the film of the camera is somewhat damaged. So obviously, the two pathologies are different, and it will not be possible to really uh, help these people with a corneal transplant. They require a different set of treatment which may be beneficial for them.
Okay. So does eye donation? No. So yeah, everything is covered in the PPT. So Komal, do we have more questions?
Yes, Payal, we have some questions.
Yeah.
Payal, can you read the questions from here?
No, I can't see anything.
Okay. So I'll just okay. So if the question is, if anyone has not pledged his eyes, can his family members decide about donation just after his death?
Yes, so this is the myths which one of which I has mentioned in my presentation, where even if you have actually not filled down, filled a form or been given a card, if the family members wish that their eyes should be donated, then that can be done. So it is not necessary that he should be first pledging his eyes, and then only he can under we can retrieve the cornea. So if the family members also decide that they want to donate their eyes, they can absolutely do that.
Okay, thank you, sir. There is one more question. People with systemic diseases like diabetes and hypertension can donate their eye.
Yes, absolutely they can. So they are absolutely eligible for donation, and we frequently in our way of life, it is very frequent that we see many hypertensives and diabetics, and their corneas are perfectly fine, and they are used so frequently, and we do get excellent results.
Okay, one more question. How can we register ourselves for eye donation?
So that is a very interesting thing which we can do. So recently, Lakshmi Eye Institute has and Lakshmi Eye Bank has instituted a I Pledge campaign, where with the help of a Google form, which will be forwarded to you, we can actually pledge your. You can actually pledge your eyes. These can be done. I'll just forward the link in the chat box, and the message can be propagated. And once that is done, you will get an acknowledgement certificate, as well as a list of frequently asked questions, and we'll have your contact number, so that we can help. We can take your help when we want to conduct this activity, and which will be also beneficial to both the parties.
Yes, sir, definitely. So, We don't have any more questions, I guess, here.
So I just have a
Komal.
few comments to make. I just would like to again thank Rotaract Club for this excellent session. And beyond this session, I would like to encourage each and every one of you to actually propagate the message of eye donation, so that we as a society can, it can be beneficial for us. As you can understand, the COVID-19 pandemic had been extremely devastating, and this has really virtually wiped out our transplant our weight. It has exponentially increased our transplant list. So any and every donation is going to be useful for these patients. So I hope you do propagate this message, and we can get this activity up and running from the Rotaract Club as well.
Yes, sir, definitely. Over to you, Paya.
Okay, so I think here we wrap up with the question answer part. So thank you so much, sir, for clearing up all the doubt and questions. So thank you so much, sir, for such an informative and wonderful session and highlighting all the necessary points to keep us aware about eye donation. I also extend my thanks to one all present here. I hope this session must have helped you in many ways and have made you look out toward eye donation in different perspectives. A special thanks to Shwarya ma'am and Komal for constant support and providing us this platform. Last but not the least, I want to conclude my thanks to all the collaborating club, Rotaract Club of Don College, Rotary Club of Navi Mumbai Jewels, Rotary Club of Panvel, Rotaract Club of SBPIM Pune, Rotaract Club of Silver City Midtown, Rotaract Club of Pimpri, Rotaract Club of Panvel Industrial Town, Rotaract Club of Ignited Youth, Rotaract Club of RSCOE, Rotaract Club of Unitech, Rotaract Club of Meraki, Rotaract Club of DYPIMER, Rotaract Club of Solapur Dynamic, Rotaract Club of Chennai Capitals, Rotaract Club of National School of Business Management, Rotaract Club of Rangoli Guwahati, then Rotaract Club of Ratnanagar, and Rotaract Club of Kolkata Metropolitan. So, thank you so much, collaborating club, for such sincere support, and thank you everyone.
Thank you very much.
Thank you, sir. Okay, so the special meeting is adjourned for the day.